Good afternoon, everyone. Thank you for joining us today for Grants and Funding, Diversifying and Securing Resources for Cancer Control. My name is Aubrey Villalobos, and I'm the Director of Comprehensive Cancer Control at the GW Cancer Institute. Before we get started, I would like to take a few minutes to go over some housekeeping remarks. We ask everyone to keep their phones on mute to avoid any background noise and disruption during the program. Also, today's program is being recorded. We will use the question and answer feature for this webinar. You will see the Q&A box at the bottom right hand of your screen. If you have a question at any time during the presentation, please type it in and we'll address it during the question and answer portion at the end of the webinar. Questions are anonymous, and I'll repeat them to the speakers. We'll take questions at the end, but feel free to write questions in the box as we go, and we'll make sure to answer as many as we can during the time allotted. We'll also use the chat box feature today, which is on the top right side of your screen. You can use the chat box to interact with each other. Because we'll be talking during the presentation, we probably won't be able to keep up with the chat, so if you want to ask a question, please use the Q&A box to the right of your screen. And as a note before we get started, the PDF of the slides is available for download on the top right of your screen. We'll also send out a PDF of the slides and a link to the archived webinar to all participants after the webinar. The recording will also be archived on our website along with all of our previous webinars. You can live tweet us throughout the webinar at GWCancerInst and use hashtags CompCancer or TapWebinar. I would now like to take a moment to review today's agenda. Ann Willis will provide a grant writing workshop, followed by Katie Bachi, who will provide a presentation on cancer prevention and control, positioning your coalition for funding. Angie Patterson will give a presentation on Georgia Cancer Control Consortium Partners, Grants and Funding Impact, and Reggae King will give a presentation on Cancer Action Coalition of Virginia Development. We will conclude the webinar with participant question and answers, and we'll do so through the Q&A feature on the bottom right of your screen. I'm so pleased to invite my colleague and today's first presenter. Ann Willis is a long-term Ewing sarcoma survivor who has dedicated her career to improving the quality of cancer care across the continuum. As Director of Patient-Centered Programs for the George Washington University Cancer Institute, she oversees the Institute's local, community, and national efforts to advance patient-centered care with a focus on survivorship and patient navigation. As Director of the GW Cancer Institute's Center for Advancement of Cancer Survivorship Navigation and Policy, Ms. Willis oversees innovative healthcare professional training and education initiatives, as well as practice-based research to identify trends and challenges related to making patient-centered care improvements. She also serves as a project director for a groundbreaking research study funded by the Patient-Centered Outcomes Research Institute to evaluate cancer survivorship care models with project partners Livestrong, the Commission on Cancer, the American Cancer Society, and the cancer support community. Ms. Willis ensures the patient perspective remains central to the Institute's work and works collaboratively with numerous stakeholders to improve cancer care on many levels. Ann?
Thanks, Aubrey. I would like to thank everybody for being here. I'm super excited about this mini workshop. So there are actually like multi-day workshops that people do that talk about grant writing and getting funding. So I'm going to try to take all of the high points and condense them into 20 minutes for you. So just so that you know, I have a background of about 10 years writing grants for government, industry, and foundations, and I've sat on the peer review side of things as well. So I kind of have a pretty good view of both sides of the funding mechanism. Sorry. So the learning objectives for my part of the presentation are to describe characteristics of types of grant funding, to discuss 10 steps for writing grant proposals, and to identify tips for writing and submitting grant applications. So one of the first things to think about is different types of funders. So there are government funders. A federal government funder could be the National Cancer Institute. There's also state or local funders, so it could be your health department, but you can also think more broadly outside of health, and maybe there are other government agencies like a Department of Aging that might be a good funder for you as well. Foundations are non-governmental entities that are established as a nonprofit organization or a charitable trust, and they have the principal purpose of making grants. So for example, the mission of the Avon Foundation for Women is to promote or aid charitable, scientific, educational, and humanitarian activities with a special emphasis on those activities that improve the lives of women and their families. Community organizations are similar to foundations, except they don't necessarily have the principal purpose of making grants. So there could be an organization that does a lot of programmatic stuff, but also has some part of it that provides grants. So the American Cancer Society, for example, does provide grants, but they also do a host of other things as well. And then industry, that includes for-profit organizations. When you're talking about health and cancer, a common industry player that we talk about is pharmaceutical companies. And there are some different names for funding opportunities, and I tend to use these interchangeably, but different funders prefer different ones, and they're maybe slightly different depending on the funder, but funding opportunity announcement, program announcement, or request for proposals are all conveying the same thing. It's just a funder asking for grant proposals. So grants can also be programmatic or research grants. A programmatic grant would be something that funds either part or all of a program that you want to run, such as a cancer screening program, whereas a research grant is more focused on researching or studying what you're doing. So you can certainly use a research grant to study a program, and you can use a programmatic grant to garner some research on the program. But as you're thinking about different funders, it might be helpful to think initially through which type of funding you're looking for, because that can help narrow down funders for you. It's also important to think about the level of control that funders might have over your project. So some funders are very involved. They want to meet with you monthly. They want to do site visits. They want to be part of the decision-making process and help really guide the project, whereas other funders, like pharmaceutical companies, can be very hands-off and only want a final report and really don't want to be involved in the decision-making process. So if you have a choice, it might be worth thinking through, what level of involvement would work best for your particular project. And there are certainly pros and cons to each of these approaches. Having a funder that's more hands-on can help point you in the right direction, help connect you with resources, but that can make it harder for you to do what you think you need to do. You don't have as much control over your project. On the other hand, having a less involved funder sounds like a great idea. It means you have a lot more freedom, but you lose out on the helpful guidance that a more involved funder might provide. And funders really vary across the continuum on this. So some of them want to be involved a lot, and some of them not at all. And then one other thing to think about that I don't know is always part of the conversation and part of the process of selecting funders is ethics. So for example, let's talk about chocolate. I read in an article recently in the New York Times, this was in October of last year, about this study looking at chocolate and memory. And the study was funded by Mars, the candy maker. And I thought it was interesting, in the article they mentioned that Mars approached a researcher to do the study, and the researcher actually says that initially he wanted to throw them out of his office. He didn't want to be involved with taking money from Mars, but then he later concluded that the company employed serious scientists who would not bias the research. Right? So in this case, the researcher was at least potentially worried about bias. And although you might not be researching chocolate, you are working in public health and might be faced with issues related to your funding sources, including bias or perception. So for example, think about what would happen if Coca-Cola came to you and said, we want to give you $1 million to host nutrition workshops. So there's a lot of money, but how might people interpret this? Does that hurt your credibility? Do you think people might be less interested in coming because it's sponsored by Coca-Cola? Maybe not, but there might be some interpretations based on this funder, and that might impact how other people think of your organization. So just another example, what if there's a member of your community who's an ex-con that has a lot of money and wants to donate a significant amount to your organization? Do you take it? You know, are there some circumstances in which you would take that funding, but maybe some in which you wouldn't? And there's no right or wrong answers here, but you may need to think about perceptions and your needs and try to balance them. I mean, sometimes you might have to walk away from a funder, or sometimes you really need the money. So again, it's a case-by-case situation, and this might not come up at all, but it is important to think about perceptions and biases when you're thinking about different types of funders. So one common question that people ask is, where do you start? Do you have an idea and flesh that out and then find a funder? Or do you look and see what funding is available and then come up with an idea? And in my experience, we do a lot of both of these, right? Sometimes we'll have projects that we have a very strong idea for. So this happened recently where I had an idea in mind, and then I found some funding mechanisms that would support that idea. But sometimes you come across a funding mechanism and you don't necessarily have a project that's sitting there waiting to be funded or waiting to be written about, but you come up with a project that fits what the funder wants. So I think it just is going to depend on the funding climate and kind of what projects you're working on. So these are 10 steps for developing proposals, and I'm going to walk through each one of these. And we'll start with identifying opportunities. So if you're looking for opportunities, start thinking about what organizations support your work. We talked earlier briefly about federal, state, and local agencies. We've talked about foundations, or their corporations, or others. Also think about going to websites. So you could go to grants.gov, foundationcenter.org has a list of foundations. We put out in our TAP e-newsletter a list of funding opportunities, and you can also ask colleagues if they know of things that are coming out. Another trick is to look at other similar organizations and see how they're funded. So even if it's an organization that's not in your state and that maybe has funders that would never fund you, look at the types of funders that they have. Are they getting a lot of industry funders? Are they getting a lot of foundation funders? And there might be something applicable in your state. Also think about whether the request for proposal is the right fit for your organization and your program. Sometimes, even if it seems like it's a good fit, you may keep reading it and just have to decide that it's not really a good fit. And sometimes it immediately is a good fit, and that's great. And then also really make sure from the beginning that your organization or your program meets the RFP requirements. Don't waste your time. We had a funding proposal, a request for proposals that we found. We got very excited. We started outlining the project. We read through it, and then only after we spent some time really thinking through how we were going to do this project did we read to one of the last pages where it mentioned that we weren't eligible because we're a university, right? So you definitely don't want to waste your time on a funding proposal that you don't fit. However, you may need to think creatively. So for example, we applied for the funding that's actually bringing you this webinar today, and one of the requirements was making sure that the organization had a national reach. And so what we did is partner. We partnered with the area health education centers to help expand our reach. So just because you may not initially meet the requirements, that doesn't necessarily mean that you can't. You just might have to think creatively. So once you have identified the opportunity, you need to carefully read through the RFP. I read through them a lot. I make a lot of notes. So you might need to do, 1, 2, 3, maybe 4 times, read through it. Highlight the key information, so the purpose of the award, any deadlines, the funding amount and length of the award, any required information, if there are formatting requirements, page limit requirements, and contact information. And I've bolded here to make sure that you follow all directions. When you actually write your proposal, a lot of funders have very specific directions, and if you don't follow them, then that may mean that you aren't eligible for funding. And then another good resource sometimes can be the program officer. So for some funders, they are happy to talk with you and help guide your project and guide your proposal, and can really help you figure out what it is they're looking for so you can tailor your project. Sometimes, though, they can't help you, but it's always worth checking to see if they can. Some funders will require a letter of intent, so this lets the funder know that you plan to apply. Sometimes they're required and sometimes they're optional, and sometimes they're non-binding. So you could send something in thinking you're going to do a proposal in one way, and then after you think about it, maybe your actual proposal looks a little bit different than the letter of intent. But the letter of intent typically is used by the funder to help decide either who can apply for full funding or help them find reviewers for the application. So step number 3, I think, is extremely important. It's very helpful to create an outline and timeline before you get started. So you should use the RFP as your guide to create your outline. Also create a timeline that includes all of the important dates. So if there's a letter of intent, there's the submission date for the proposal, and think about who in your organization is preparing what. And it's really important to think about this in advance so that you have lead time in case things come up. And it's important to think about the policies for your organization. So here we have about a week in advance of submission where we need to submit it internally for review. So even though the funder needs it on one day, we need to have it well in advance of that so it can go through our internal review process. And it's important to plan ahead and make sure that you have all of the right people that are around. So a lot of times they'll require a signature from somebody, whether that's the PI or an authorizing official. For example, we had a proposal that we were submitting, and it needed a signature, not just a file signature, but it needed somebody to hand write out the signature, and the person who needed to sign it was on vacation. Right? So it's important to think through these things in advance so you aren't caught by surprise at the end. And I'll show you an example of a timeline that we've used before in just a second. But timelines are also important to consider when you're thinking about funding opportunities. Some funding mechanisms are ongoing and some are one-time. So it could be something that is renewed every 6 months, so you can apply every year, or it could just be that the funder has a pot of money that they have for this one time. And then for one-time opportunities, you may get as little as a few weeks from the release date to the due date. And we've definitely had that happen where we had about 3 weeks to scramble and pull together an application. And something to remember is that even the easy sections take time. Even the things that you know are not going to take very long, those take time. And you need to make sure you factor in time to write it and rewrite it and maybe rewrite it again. So some common components of grant proposals are the narrative section, which has background, significance, innovation, and approach. Facilities includes what resources you have, things like computers and printers and copiers. Personnel includes the bio sketches, anything that's relevant about staff, and then budgeting may need to be done a single year or multi-year, and you need to make sure that you can justify every single item in your budget. So this is just a quick example of a checklist that we prepared. It has what's needed, page limits, who's responsible, and due dates. So also think through your audience. So who is it that you're talking to? Who's on the panel? Is it lay people? Is it researchers? Is it program staff? Be careful to know who your reviewers are so you aren't insulting them in your narrative and saying something negative about the work that they've done in the past. You should be able to speak to multiple stakeholders and make sure you know who makes the final funding decision so you can speak to that audience. Then you need to gather important supporting information. So is there publicly available data? Is there pilot data or other evaluation data about your program to show effectiveness? And are there other organizations that you can work with to help leverage strengths? So develop your problem statement, and this will help guide your narrative. So think about what problem you're trying to solve. And does it address a current gap? Is it novel? Will it have a big impact? And is it current and relevant? So for time, I'm not going to read through this, but you have access to the slides and can read through an example problem statement. So when you write your proposal, you should be as specific as possible. You should think about the significance, why it's important, why it's innovative. Your approach needs to include specific work plan and deliverable items, goals, objectives. You might need a logic model. Use a lot of diagrams and charts because reviewers might be reviewing 10 or more applications at the same time, so make it easy for them to read. And make sure that you tell a compelling story. And then this slide, I think, is probably one of the most important slides. Even more important than your idea is how well you sell it. So don't just use buzzwords. Clearly demonstrate why your idea is important and make it easy for the reviewer. Framing it can be way more influential than your idea. So be logical, cite relevant and recent resources. You can use some formatting options using bolding and italics and underlining, but be careful because you can go way overboard with that very easily. And then spell things out for the reviewer. Make it easy, be direct, and use the funder's language as often as you can. And then when you frame your argument, the general template that we use is to say something about why it's a significant problem, talk about promising solutions or what's been done already to address the problem, identify gaps, and then talk about how you're building off of that for your project. And here's an example. It's in the slides. I'm not going to read through it right now. So also make sure someone else reviews your proposal. Make sure that they can understand it. Even if they're not in your field, they should be able to have a general understanding, but it can help to see if there's holes or gaps or to make sure you have all of the required components. And then hopefully you submit your proposal on time. Again, you need to make sure you know what the process is. You never know when the website's going to go down, when your internet's going to go down. So make sure that you do that with plenty of time. And then the review process can vary by institution, but usually some sort of reviewers will review it. They might meet in person. They'll go over the different proposals and kind of rank them. And based on how much money, they'll figure out who it is that they're going to fund. And then you might have to revise or resubmit, and it's a cycle, so you might have to do all this all over again. Make sure you read all reviewer comments and revise your proposal. You might need to send a memo about what you did address. And remember that you might have some of the same reviewers for your resubmission. And you also, even if you don't get funding, you might be able to repurpose a proposal for another funder. And then just some quick tips. First, identify the right people that you want to include. We mentioned earlier a well-written proposal that's been edited and makes sense is key. A tip that I like to say is to write it for a really smart 8-year-old, so you make sure you hit different stakeholders. Use evidence to support everything that you say. Plan out your process in advance. Give yourself some time to put it away and come back to if you have that opportunity. And then sometimes the craziest good ideas will get you funded. So just because you think it's kind of out there doesn't mean it won't get funded, but it just depends on the funder and the funding climate. So that is all I have, and I will turn it back over to Aubrey.
Thanks, Anne. Perfect timing. I really appreciate you sharing that information with us, and I just want to point out to everyone in the links pod, there's a bottom link from the Grant Training Center. There's an awesome blog post that we came across just yesterday that echoes and summarizes a lot of what Anne talked about and has some additional pointers, so we encourage you to read that. It's a pretty easy read. Our next speaker is Katie Bache. Katie is the Program Director for the Kentucky Cancer Consortium, the state's comprehensive cancer control coalition comprised of more than 70 state-level organizations spanning healthcare, nonprofit, academic, and governmental sectors. And for time's sake, I apologize, I'm going to just read the beginning of the bios, and all the speakers' bios are available on our website if you need more information. But Katie, I will turn it over to you. Thanks for joining us.
I'm from Kentucky. I'm Katie from Kentucky, and I'm really happy to be here with you all today. I thought I'd share you a little bit about Kentucky's story and a grant opportunity that came our way recently and how I feel like we were able to be positioned to be ready for that opportunity. So I don't want to belabor this point. You all are obviously comprehensive cancer control partners, or you wouldn't be listening, but we throw around this definition quite a bit when we are at meetings together, and I wanted to point out a couple things about it that I think are salient to grant applications. The whole concept of comprehensive cancer control can come across a little bit touchy-feely to folks who don't speak the language. But what I really try to emphasize when I talk to partners in cancer is that it is all about collaboration, and that collaboration is often a process that takes time, and it's a way that we're able to pool resources and to reduce the burden of cancer. So what do I mean by collaborative process? And I'm going to talk a little bit about that today. Basically, why do you do what you do? See the picture that I put up there? It reminded me of Red Rover, Red Rover. When we are united in a coalition, we oftentimes have far more strength than if we were just one and done and trying to do things in our own silos. So the whole process of working together, this collaboration, enables us to be stronger. So what does that mean in Kentucky? Well, in Kentucky, we have a unique situation where our state coalition is able to focus on state-level partners, and then we have a partner program called the Kentucky Cancer Program that focuses on regional efforts. What that allows us to do is to really stay a lot at the policy level and affecting change in our capital in Frankfurt, but it also allows us to really spend a lot of time working on cultivating relationships at the state level. And we like to think of ourselves as Switzerland, basically meaning we are a neutral forum that tries to bring folks together and not necessarily even brand ourselves out there as an organization per se, but more like a table at which a lot of organizations in cancer control can sit. I think that one of the benefits of being neutral like this is that we don't compete for funding. We look for opportunities for our partners to apply for funding. So it really has, I think, engendered a tremendous amount of trust with our partners that we kind of hand the baton over, and when money becomes available through grants, we're able to be the person that convenes and coordinates everyone, but isn't necessarily competing to have those dollars housed with us. Now, oftentimes, as you all know, working with coalitions, you have to act almost like a peacemaker between organizations that might have a long history of not necessarily working well together, or just some preconceived biases, and maybe they're fighting for those dollars amongst one another. That's where I think the coalition and the staff of the coalition can really be game changers. We're the ones that are bringing folks together, become the trusted resource, become the Switzerland, so that we can bring these organizations together and be almost the focal point around which these other organizations work in cancer control. And I say this because I feel as if the time that we spend in cultivating relationships is not often easily measured for work plans or outcomes, but it reaps such rewards. And I want to point out some of the tips I feel like that are essential to keeping your coalition healthy, which is going to make you in the best position possible for grant funding. A few years ago, the national partners, and some of you might have attended this, did a conference in Atlanta, and basically what they wanted to come out of that conference was a list of habits or characteristics of coalitions that are considered successful, quote unquote. And so I'm shamelessly borrowing from that. We put the link down in the corner, as you can see. It's on the Research to Reality website in the Coalition Corner area. And it was ACS and CDC that came up with 9 habits of successful comp cancer control coalitions. And I wanted to highlight, I obviously don't have all of the habits listed here, but I wanted to highlight a couple that I feel like really promote that collaborative process that we talked about in the first slide for coalitions, and say why it's a value for getting grants. First of all, if you are in a coalition that shares decisions amongst your organizations and don't have, and not one partner is necessarily dominating the conversation, I feel like that positions you really well to go in as a group for grant applications. So making a point of basing the decisions on your data in your state and county level and on the input from your coalition members is hugely important in building trust. And then on almost everything that we do at the Kentucky Cancer Consortium, we try to approach it with how can we make this a win-win? How can it be something that benefits not just the consortium as a whole, but as many of those individual partners as possible? As you all know, you're often trying to get people to the table who have day jobs with lots of other responsibilities, but what can you do through this collaborative process that can make it a value-added thing for this person to come to your meetings and to be a part of your coalition? That's kind of ground level for everything we do at the consortium, is trying to make things a win-win. We don't always succeed, but we try. And then this is the habit number 4, staff. I think that it's really important to have staff that recognize the importance of partnerships and the importance of people getting along and sharing their toys, so to speak. You can't wave your wand and make that happen for your coalition, but I will tell you I feel like it's really, really important to have a healthy dose of emotional intelligence. What does that mean? That means that your staff is willing to come to the table and not necessarily be recognized or have their logo on everything, but be a team player and provide some technical assistance that would be really beneficial for the collaborative group. Another thing that I wanted to share with you from those 9 habits is it's really important to have, and I bolded it here, a work plan. All of us are required to have a cancer action plan for our state as coalitions, but I would encourage you to think about what are the big 3 things in your cancer plan that you want to address. What are your priority cancers, let's say, your priority issues, and how much would it really cost to fully implement those high impact objectives? We brought this question to our coalition after we cultivated this kind of trust, and we were able to have breast cancer organizations acknowledge, you know what, smoking and lung cancer are really the biggest issues in our state. We'll be honest. How can we come together with you as a group and make a change in this area? So we brought the group together and put together what's called a resource plan. Basically, we looked to health economists in our university and other volunteers in the insurance industry to help us put some real numbers on how much it would actually cost to implement some of our Cancer Action Plan objective. And we developed this document that's about 13 pages long. Again, I have it over here that you can click through and look and see how much an investment through a grant or a foundation would bring to bear on the collaborative work that we were doing as a group. So the keys to being well positioned, it's all about relationships. I know it's hard to measure for your work plan, but I can't stress it enough. One of the best relationships that you can have is with researchers. I needed to have a few researchers for my big topic areas so that when things come to bear, I can call them and have the relationship with them to say, I really, really need you to help me write this grant. And because the relationship is there and healthy, they're usually more than willing to come alongside me. And then the other key to us being well-positioned was a resource plan. We talked to our registry. We identified our big cancer problems. We found a professor who specialized in health economics to be a part of this team. We talked to Medicaid and say, how much are you charging for tobacco cessation products? And then we were able to incorporate that in our cost. And insurance companies, and we got them together for this resource plan. And the combination of having those built-in, ready-to-go relationships and the ready-to-go resource plan so that if money dropped from the sky, we'd be ready with a plan for it, came to bear when we got an email from Bristol-Myers Squibb Foundation. Several of our collaborators got the same email. Instead of us all going to our 4 corners and applying on our own, as staff, part of my job is to bring people together. So I proactively contacted the folks who I figured would be lung cancer players for this funding, because it was a lung cancer funding, and said, let's get together, and what if, here's something crazy, we applied as a group instead of our own institutions. So we met meetings after meetings after meetings, which were only able to be held because we had existing relationships with these folks in our coalition, and they trusted us. And they agreed to go in on a collaborative application. And Bristol-Myers Squibb ended up awarding us $7 million for a lung cancer survivorship program that is now up and running in Kentucky. And it wouldn't have happened if it wasn't for the collaboration of our partners, so the relationships, and the resource plan we had in place. So please feel free to contact me after the seminar, and I'd be happy to answer any questions that you have. Thanks so much for asking me to be a part of this.
Thank you, Katie. That was a great presentation, and I think there's a lot that we could learn from Kentucky. Our third speaker today is Angie Patterson. Angie Patterson is Vice President of the Georgia Center for Oncology Research and Education and is a 14-year cancer survivor, and the rest of her bio is available on our website. Angie, I'll turn it over to you. Thanks so much for joining us.
Great. Well, thank you so much. I'm really glad to be a part of this conversation. I think discussing funding is really important for the various coalitions, and I think Katie really hit some key points about collaboration and communication. And what I wanted to talk about today from Georgia's perspective, I'll give you a little overview of our plan, and I will walk through some of the examples. Sorry, I'm catching up with the slides here. A little overview of our Cancer Control Consortium, talk about the importance of the steering team. I think Katie touched on that in her presentation, and I'll show you how we've made up our steering team and what the value that is. What I want to talk about is the impact of funding and grants that partners that are a part of the consortium, what that value brings to the table. That may not be funding for the consortium per se, but the objectives of those grants and funding actually apply towards the objective in the Cancer Control Plan. And so I'm going to give you all some examples of what we've done here in Georgia and continue to do. So our plan is comprised of 8 priorities, and on the GW website you can go in and look at the various components of the plan. A couple of things I wanted to highlight as I go through this is in our previous plan, I've been involved with Cancer Control Plan since 2005, almost, that is 10 years. And I joined the steering team when we were revising our Cancer Control Plan for the 2008 plan. And in that plan, we had what we called overarching objectives around survivorship and palliation and patient navigation. And we realized in this next round of revision of our plan, we really need to pull those into priority. So you'll see number 7, we have access to palliative care and survivorship, and then we have case management and care coordination. And I wanted to highlight those because I'll give you examples of things that are going on in the state that actually help us track how we're doing on those particular objectives. But it's actually grants that other organizations have been able to acquire. And on this page and on the links section, you can link to our Cancer Control Plan as well. So the structure of our consortium, we are not a separate coalition. We're not previously we had a 501c3 in Georgia that was a cancer coalition. That has gone away, so we've created the Georgia Cancer Control Consortium. So we're a virtual organization, and over the years, we really look at who are the right people at the table. But our structure here is really important for me to highlight, and I'll tie back in funding and grants to that. We have 5 specific working groups that will map up to our priorities: prevention, education, early detection, screening, diagnosis, staging, and treatment, palliative care, and survivorship. But the steering team is in the middle of all of that. And so members of the steering team either chair or co-chair the working groups. And I think that's really important that on a monthly basis, the steering team comes together. We hear the report outs from the working group, so we know what's going on. So sitting at the consortium steering team table, we're able to know of things that are going on in the state or at a national level, and we're able to connect resources together to say, hey, I know you specialize in breast cancer screening, so let's put you together with another organization and maybe you can apply for grants. So I think the structure is important to have a little overview of that. So I'm going to highlight 2 slides about the members of our steering team. And these are just the logos, but of course public health is our key partner in this. I am the co-chair for the consortium, and Dr. Jim Hotz is the other co-chair. He's a primary care physician in South Georgia. We have all of these various people at the table. So on the next slide, I'll walk through a couple of key things we've learned over the year about having the important role of the steering team at our table. We have in Georgia a unique situation with regional cancer coalitions that receive tobacco settlement funding through the state, and they actually exist in a community and have responsibility for various counties in their area. And I'll talk about some of the grants that they actually get later on. But you can see that we have academic institutions, we have local hospitals, we have public health, we have organizations, for example, the American College of Physicians. The executive director of that is on our steering team so she can get communication out to other organizations. But I wanted to kind of highlight some of the grants and funding that have been gotten by other organizations, but as I mentioned, they actually apply to the value of comp cancer control. And I'll talk a little bit about Georgia Core. I'm the Vice President of Georgia Core. And our main objective, our role is we're a public-private partnership dedicated to generating collaborative resources. And so our mission has been to bring people to the table to try and tackle these cancer initiatives for the entire state. I've got a list of some of our way of getting funding for our organization. But I wanted to highlight, we recently were awarded a PCORI pipeline to proposal grant around survivorship. And survivorship is one of our priorities in our comp cancer control plan. And so that has been a mission of Georgia Core. So we actually partnered with another lead from Mercer University to apply for a PCORI pipeline grant. While that funding does not come to the consortium, it comes to Georgia Core, but the intent of that grant is to improve survivorship, to improve the quality of life for cancer survivors in the state. So one of the things we're trying to do at the steering team level is we've put together a template on how to capture this kind of funding. This funding really helps us meet our objectives in our comp cancer control plan, but it's not true funding that the consortium themselves have gone out to get. We also recently had private funds a year ago. We have a private donor who gave us funding. He is a cancer survivor. He lost his first wife to cancer, and he's really committed to the whole survivorship aspect of the continuum of care. And he gave us funding to develop a portion of our website that highlights survivorship resources. So while that funding was private money that came to Georgia Core, it helps us to accomplish the objective in our comp cancer control plan that says improve the quality of life for cancer survivors in our state. We also were very involved with a Georgia NCORE grant, which is the NCI Community Oncology Research Program. Georgia Core partnered with Northside Hospital and St. Joe Candler to write this grant and get a multi-year grant to really focus on research in our state. But some of the components of that grant, well, actually all of the components of that grant, map back to our comp cancer control plan. It's focusing on clinical trials. It's focusing on cancer care delivery research. So all of the results of that grant funding will actually be able to be tracked back into our comp cancer control plan and acknowledge that we're helping to meet those objectives. One other thing, in Georgia, we have the breast cancer license tag grants, and Georgia Core administers that. That's funding that people pay for the breast cancer license tag. It goes into a fund, and we administer grants to provide access to care and treatment services to indigent women in Georgia who can't get the services or the education they need. So while that is funding that comes to Georgia Core from the State Office of Rural Health, that actually helps us improve the screening rates and the education rates for breast cancer, which is one of our objectives. Georgia Society of Clinical Oncology, GASCO, is part of our steering team. And in 2009, GASCO and Georgia Core partnered together and created an organization, a statewide organization called the Cancer Patient Navigators of Georgia. And you have that link in your little section on the screen. And while that was a collaborative effort between GASCO and Georgia Core, that is actually one of the objectives, one of the priorities in Comp Cancer Control Plan. So the money that GASCO invest in the Cancer Navigators organization, providing an annual meeting, providing a website and resources, helps us meet the objectives that are in our Comp Cancer Control Plan. Part of our communication plan for the Comp Cancer Control Plan here in Georgia was to go out and have our regional cancer coalitions host meetings to educate their partners about Comp Cancer Control Plan, and the American Cancer Society provided funding for 2 pilot regional meetings for us to then assess, was that really effective, and determine going forward, do we want to have those kind of meetings. And so on my last slide, I do want to talk about the regional cancer coalitions of Georgia. There are 5 different organizations, and I've listed them here, and their links are available to you as well. But they're nonprofit organizations, and they do receive funding from the state, just like Georgia Core receives funding for the state. But they, as a nonprofit, have to go out and partner with their local hospitals or healthcare providers in their area or other nonprofits to get funding to implement programs in their state. They are the resources the Department of Public Health. For example, 2 years ago, the Department of Public Health received a survivorship grant, and they gave the opportunity to the regional cancer coalitions to get funding to go out and do programs in their communities. So our regional cancer coalitions are actually the boots on the ground that have that relationship with our communities in the state. And so they're very instrumental in getting the Cancer Control Plan implemented, but also their funding that they are gathering, that they are being awarded in their communities, all of their objectives map back to the Cancer Control Plan. So I think one of the key things I wanted to highlight is the importance of your steering team. Know who's on your steering team. Bring to your steering team people who are actually doing the work, people who are able to partner together and collaborate. And I think one of the really important things we've learned is the importance of tracking these resources that other organizations are able to be awarded or to be given gifts to work on the Cancer Control Plan. So my contact information is up, and if you have any questions or want to shoot me an email, I'll be glad to share some additional information. And those were just some of the highlights. There are many other types of collaborative grants and funding that are being received in our state, and they were able to map it back to what we're trying to accomplish in our Cancer Control Plan.
Thank you so much, Angie. Our final presenter today for today's webinar is Reggae Polanco-King. She is the co-chair for Cancer Action Coalition of Virginia, and she serves as a primary relationship manager with responsibility for prospect research, recruitment, cultivation, and retention of targeted priority hospitals. And the rest of her bio is also available on our website for your perusal. Reggae, thank you for joining us.
Thank you. Good afternoon, everyone. A pleasure to spend a few minutes with you to share the work of the Cancer Action Coalition of Virginia. We are a 501c3. We received our 501c3 designation approximately 3 years ago. We are a coalition made up of 100 members representing public, private, and nonprofit organizations, and we are a working board. Our board is made up of 9 board members, and we are divided up into 4 action teams representing prevention, early detection, treatment, and palliative care and survivorship. This year we were very fortunate in that our Virginia Department of Health allocated a staff member to provide administrative support to the coalition, which has been a true blessing. As I mentioned, we are a volunteer board, so all of us have full-time jobs, and we are committed to the coalition, but having this additional administrative support from the state was truly, truly a welcome gift. With our 501c3 status, the reason we sought it was to be able to apply for grants and fundraise, and to no longer be dependent on other organizations to act as our fiduciary agent. We had conferences in the past where we would have one of our member organizations be responsible for the monies coming in and out, and that was kind of messy. We do have a development committee in place which is responsible for identifying fundraising opportunities, and for 2015 we focused on 4 areas. We are having a conference in the fall. It's entitled New Frontiers for Cancer Care. We invested some time in the Combined Virginia campaign, and we are joining our local community foundation's Amazing Rays, and currently we are in the exploratory phase for a Cars for Donation program. Of course, all of this development is in an effort to support the activities of the action teams, again, in prevention, early detection, treatment, palliative care, and survivorship, in support of our state cancer plan. We currently have a 5-year plan in place from 2013 to 2014, and one of our long-term goals is to eventually be able to hire a staff person to either in an ED position or some kind of additional support for the coalition. Our fall conference is scheduled in the western part of our state for October 15th and 16th. It is an opportunity to highlight the advances in care in the state of Virginia. We have 2 NCI cancer-designated centers, and we wanted to highlight the advances that have been made at both institutions, along with the advances in care from the private health systems. We have a goal of 200 attendees. We'll be providing CME and CNE credits, and we have sponsorship opportunities available. We are charging $150 for individuals, and thus far have had a good response to the planning for the conference. The second area we focused on this year was the Combined Virginia campaign. Many of you all may be familiar with your state's employees' way of making a donation through payroll deduction. Federal employees started this many years ago. Our state has a robust program with a very low percentage of overhead, which means that most of the money that is designated by Virginia employees go to their charities of choice. So this year we went through the application process so that we will be included for 2016, so that state employees will have the opportunity to select us as a charity through payroll deduction. One of the advantages to being selected for this program, we are invited or can be invited to opportunities where state employees during the enrollment period can learn more about what the coalition does and what its goal is in Virginia as far as eradicating cancer as a disease. The second area that we're focusing on is through our community foundation, and this slide just covers what community foundations do throughout the United States. Here in Central Virginia, we have a very strong community foundation that's seen tremendous growth. As a reminder, it's a way for donors, be it individuals, corporations, to set up funds that address the needs of a community, and health is one of the areas that our community foundation in Central Virginia focuses on. So what the Community Foundation did a few years back, just to kind of boost fundraising for nonprofits throughout Central Virginia, is to have a 36-hour online fundraising opportunity, and it was instituted in 2010 and actually began in 2011. And as you can see from the information I've provided, it has generated quite a bit of funding for nonprofits. I happen to know that it benefits the smaller nonprofits in a big way. On average, it can bring in $6,000 to $12,000 for small nonprofits that haven't seen that kind of funding come through their door. The foundation itself puts in close to $200,000 of their own money as incentive prizes. So for example, during the 36 hours of fundraising, they'll have contests where, you know, a nonprofit organization that has the most members make a donation at 6 a.m. in the morning will be awarded $1,000. So those little incentive prizes are very exciting to the small nonprofits. We get the word out through our membership, and as you can see from the information I've provided, we have a far reach. Not only do we have funding come in from our own state, but through that network of membership and friends and social media, we are also drawing funds from across the world. So again, these are our efforts that we've put in place to try to increase the amount of monies we have in place to specifically support the aims of the state cancer plan. And I think I took a lot less time than everybody else, but I hope this information was helpful. It was our demonstration of how when we don't have a dedicated fundraiser in place, through volunteerism and through the efforts of the board and coalition members, we can make an impact in increasing funding for our coalition.
Thank you so much, Regé. We really appreciate it. And thank you to all of our presenters today for joining us and sharing their experiences and expertise. We had a real diversity of opportunities here that coalitions have been able to get, and then advice from Ann on grant writing. So we'll now begin the participant question and answer portion for the last year. So please send in questions if you have them. Our first question goes to Ann and Katie. Was there any internal debate about accepting pharma money for Katie, when the Bristol-Myers Squibb opportunity came up, and for GW Cancer Institute? Could you talk about that a little bit in terms of what Ann mentioned earlier about ethics?
Sure. Yeah, there had to be a real distinct forthright conversation and line drawn with our partners about the difference between accepting money from Bristol-Myers Squibb as opposed to accepting money from Bristol-Myers Squibb Foundation. And if you go on their website, they really do try, although we all know that they're obviously connected through name, and that the foundation doesn't have any influence, let's say, on whether you use any of that money towards any of their purposes. So the affiliation is in name only for the purposes of the grant, if that makes sense. So when they came to us, we had a really honest conversation, obviously, with the whole of our collaborators, and felt like after we did, reading and talking with the director of the foundation, their BMSF, we were so pleased with the freedom that they were going to be giving us as focusing on what we wanted to be our coalition priorities. What did we want to be the focus of the survivorship grant? And it really was no strings attached in that sense. But sure, there was some leeriness at first, but the researchers that we have at the head of this grant make no bones about the fact and stress a lot that it's Bristol-Myers Squibb Foundation. They always put the emphasis on the last word.
Yeah, I've been at other organizations that have used a lot of money from pharma industry, and there's just a lot to think about, and to think about what your priorities are. I will echo what was just said, that a lot of times the pharma companies don't have control over the actual content of what you're producing. So I think that helps to create some sort of firewall between them, so the perception might not be as bad. But there are also different types of pharmaceutical funding, which we just kind of talked about. There's medical education grants. So if you're hosting a meeting, for example, that kind of funding might be something that you're willing to accept, whereas if you're creating a patient education material, that may or may not be something that you want. So I think sometimes it might be a case-by-case basis depending on the project, or you might just want to have some sort of overall policy for that.
I will say one of the reasons that we kind of all fairly quickly agreed here in Kentucky to go for this as a group was because we were finding over the past, I would say, 10 years that I've been with the coalition, that there were very few opportunities tailor-made for us from foundations. And if they were real small community foundation grants that, to be quite honest, and I know this sounds jaded of me, it didn't seem like we had it was worth the time. So to put together a huge grant application for just a couple $1,000s, and so this opportunity was almost too good to pass up. The opportunities that I see more often as a coalition director is in research, and this very much was a research grant, which is why we spent time trying to develop those relationships with researchers at the ready to write a lot of the content for us, and then give the partners in the community that are part of our coalition the benefit of implementing or helping conduct some of that programmatic research.
Great. Thank you so much. Angie or Regay, any final comments or advice to the listeners about what they can do immediately walking away from this webinar to help better position their coalition to get additional outside funding?
This is Angie. The one thing I would like to emphasize that I think is really successful with cancer consortiums or coalitions is looking at who's at your steering team, who's at your table, understanding what their expertise is, so that they are in a position, as Katie mentioned, being ready to go. If a grant comes up, for example, the Department of Public Health received notification that CDC offered a survivorship grant to the comp cancer control plans. But the fact that we're all working so closely together and collaborative and partners, they knew that Georgia Corps has done a lot of work around survivorship, so we were able to pull together and share information for them to make that application. So I think understanding what everyone is doing and being able to connect those dots is really critical.
And this is Renee. I think the takeaway I'd like everyone to have is that through the membership of the coalition itself, I think I failed to mention that the planning for the conference that we're doing in the fall is entirely driven by a committee made up of members. And not only have they helped develop the program, but also are being the liaison to their own organizations for sponsorship opportunities. So it's a collective effort. It is some time needed, but it's probably a group of 10 to 12 of us that have developed the program for the conference, and I think it will be a successful way for us to generate some funds.
Great. Thank you so much, and thank you again to our speakers. It is now 3 o'clock, so I will let you all go. I just want to say thank you so much for attending. Please take our evaluation survey on your way out, and please continue the discussion on Research to Reality. We have a page up there where we'll be able to answer the rest of the questions that came in. Thank you so much, and have a great afternoon.